What really happens during a DOT physical? Drivers ask me this every single day because a lot of people come in nervous. They've heard stories online. They've heard stories at truck stops. Some drivers are afraid they're going to automatically fail if their blood pressure is high, if they take medications, or if they have diabetes. So let me calm your nerves and explain what actually happens during a DOT physical. First, the purpose of a DOT physical is safety. The Federal Motor Carrier Safety Administration wants to make sure drivers are medically safe to operate a commercial vehicle. That's it. The goal is not to trick drivers. The goal is not to fail everybody. And honestly, most drivers passed. Now, when you first arrive, there's usually paperwork. You'll answer questions about your medication, medical history, surgeries, sleep apnea, diabetes, heart condition, vision issues, things like that. One thing I'll tell drivers all the time, be honest. A lot of problems happen when drivers try to hide information and then it shows up later in medical records, medications, and previous evaluations. After the paperwork, we take your vital signs. That usually includes blood pressure, pulse, height, weight, vision, hearing. And let me say this, because this is a huge fear for drivers. A slightly elevated blood pressure does not automatically mean you fail. There are guidelines. There are temporary cards. There are situations where drivers simply need a follow-up care. Next is the actual physical examination. That's when the doctor checks your heart, your lungs, your abdomen, reflexes, mobility, balance, general health. This is usually much quicker and simpler than the driver expects. Most drivers walk out saying, "That was easier than I thought." Now, depending on your medical history, the examiner may ask for additional documentation. For example, sleep apnea compliance, blood sugar information, cardiac clearance, medication list, CPAP report. That doesn't automatically mean disqualification. Sometimes it simply means we need more information to safely certify you. And another important thing drivers need to understand. Some drivers receive a 2-year card, some receive a 1-year card, some receive short-term cards. That doesn't mean you fail. Sometimes the examiner simply wants to closely monitor your blood pressure, your diabetes, your weight, or other medical condition. And honestly, that can protect the driver long term because many drivers are pushing their bodies extremely hard out on the road. My advice to drivers is simple. Don't wait until the last minute. Get sleep before your appointment, drink water, bring your medication list, bring your glasses if you wear them, bring any medical documentation. And most importantly, don't panic. A good DOT examiner is there to help drivers understand the process while keeping safety first. And at the end of the day, drivers, you guys are the backbone of this company. And my job is to help keep drivers healthy, compliant, and safely on the road. I'm Dr. Pope. If you found this video helpful, follow me for more DOT physical and driver health education.